Good afternoon, everyone. I'm Dr. Scott Chavers, Director of COVID Response here at the Mobile County Health Department. This is Friday, November 6th, COVID update. So globally, we're at 49,100,000 cases with 1.2 million deaths. The top cases globally by country is still the greatest in the US with 9.6 million, followed by India at 8.4 million and Brazil at 5.6 million. In terms of mortality, if we look at the US, we're at 935,347. For Brazil, we're at 161,736, and India is at 124,985. The state of Alabama, as of today, is reporting 200,714 cases. That includes both laboratory confirmed and probables. And then we have 3,049 deaths. So if you look at our daily report that was issued this morning, we are reporting in Mobile County 17,773 cases cumulative. We've had an increase in 80 over the last 24-hour period. If you've been looking at the daily reports, you've noticed that our per day number has increased. That is twofold. One, we are now including the point of care test in most of those days' reports, and we are seeing what is likely to be a true increase in the number of cases. For our more concrete number of hospitalizations, we're at 2,344. Cumulative, that is an increase of 8. And then in terms of mortality, we're at 328 with an increase of 1. If you look at our graphs, what we are very pleased to report is the big spike that we saw the week of October 18th is about to roll off. So if you're looking at the trends for the 7-day and 14-day moving averages, those will start to moderate, and you will start to see those bars increase as there have been changes to the maximum numbers that have been included there. Demographically, we're continuing with the same trends, with the greatest number of cases by age group continuing to be in the 25 to 49-year-old age group, with the greatest number of deaths being in the 65 and older. As I mentioned today, we have 2,344 total hospitalizations. We also have 83 currently hospitalized. That's an increase of 1 over the last 24-hour period. You'll notice if you're looking at the trends that we have steadily increased from about 4 weeks ago, where we were seeing our currently hospitalized rate in the 60s. We are now at a fairly steady rate, holding at the low to mid 80s. All right. And then if we look at the county level with respect to our risk status as reported by the Alabama Department of Public Health, this was updated today, and we did move into the very high level. There are 4 measures that are included in setting the parameters for the level of risk from low, moderate, high, and very high. Those include the percent positives, if it's increasing or decreasing, the emergency department visits with COVID-like symptoms, whether we're meeting the testing goal, and then our percent positivity rate. So we actually have not met the metrics for performance in each of the 3 categories except the testing goal. So the testing goal is set at 0.8% over a 2-week period, which in Mobile County, we easily meet that number. If we look at the complaints that we have received over the last 5 days, we did receive 5 complaints in total, primarily from restaurants. We do encourage you to submit complaints to iscomplaints@mchd.org. We do follow up with all these complaints. We do ask you that you please submit your name, the name of the business the date if possible, and the violation that you're concerned about. All right, so a couple of things that have happened this week. I think one of the primary announcements that occurred yesterday was Governor Ivey's extension of the amended Safer at Home order. This was extended through December 11th at 5 p.m. So there were a couple of changes. The primary change came in the change in the emergency level in terms of occupancy rates. So if you remember the old Safer at Home order, these were built on percentages of capacity. That has been removed. So you do not have a metric now for for retailers, gyms, and fitness centers and entertainment centers that are based on percent capacity. What you do have, and this is important, is that it's still based on social distancing of 6 feet. So as you're looking at your establishment, the easiest way to do that is to look at what your usable area and square footage is, and then take a 6 by 6 square foot, look at that, and that will tell you what your square footage is. The other change, and I've heard this reported a couple of different ways, so I want to be very clear here. There has been a change in areas like salons, hair salons, etc., where there has been a loosening of the social distancing, i.e., that 6 feet buffer requirement. However, that distancing can only be offset if you are wearing a mask and you have a non-permeable partition between, let's say, in a hair salon, between one chair and another. If you cannot maintain that, you do still have to maintain the 6 feet of social distancing. The other areas in terms of what has stayed this change, they're listed on the Alabama Department of Public Health, so no real changes there. I do want to reemphasize that masks in schools are still required. Masks while you're in public and you cannot maintain the 6 feet social distancing are required. And I want to also emphasize this, that the mask and the social distancing go hand in hand. So mask will mitigate if you're closer than 6 feet, but you should try to maintain a 6 foot distance and wear your mask whenever possible. Okay. So a question that we received came in about the changes in the occupancy rate, moving away from the percentage and from the potential effect that it would have on retailers, gyms, and entertainment venues. So even though the occupancy rates for certain businesses have been lifted, it is important to remember that, particularly when we're heading into the holidays, that it is critically important that you maintain the 6 foot distancing and wear your mask, particularly when 6 foot distancing is not feasible. So again, the mask and distancing work together, but as stores get crowded, please keep that in mind. Give that 2 arms length distance between yourself and the person in front of you, and try to keep that between you and the person behind you. Hospitalization rates in the state have risen, and we are seeing more cases. So the question is, even though it's now possible for more people to be inside, should businesses be gathering or allowing crowds? And that is absolutely not. So nothing has changed with respect to the virus. The virus is still as transmissible as it was before the amended Safer at Home order. So you do need to maintain the 6 foot of distance, and you do need to continue to wear your mask. You need to wash your hands before putting on your mask and after taking it off. Use hand sanitizer. Do not touch your face. And if you're sick, particularly as the stores get crowded, stay at home, please. That's not a gift you want to give for the holidays. The final question that I got from the media is that Black Friday shopping is coming up. Is this another event that could lead to a spike in cases due to occupancy limitations being lifted? So anytime we start removing mitigation activities, so let me just distinguish between there's been a change in percentage of occupancy to a return to the 6 foot distancing, and that has been very consistent, as well as the mask wearing. You need to maintain that. So please wear your mask. Please maintain the social distancing. It should not be interpreted by Governor Ivey's amendment that any of this has been relaxed in terms of what our concerns are with respect to COVID-19 transmission. All right, so we received a couple of Facebook questions. Sometimes we have to interpret these. So one of these was, so still a 0.04 per capita. So I am guessing that this was from one of Rendy's statistics she gave out on Monday, where the rate is about 4,300 per 100,000 persons in Mobile County. So if you don't do the 100,000 multiplication, you do get 0.04. So, I mean, if you want to use 0.04 for every person, feel free. The problem with that is that's not really allowing you to do comparability across counties, adjusting for population like we do, but whatever kind of statistics you're doing at home, whatever floats your boat on that. And then we had another question that said the moderate risk category doesn't include point of care test, does it? That is correct. So the point of care test, which are antigen tests, are not included at this point on the state risk dashboard for the counties. The other thing I would mention is that these data do lag from the data that we give you. So when you look at the data in the risk category that I reported earlier, which is high risk, that's really based on data we had 2 weeks ago. I can tell you that in 2 weeks, when we look back, we're still going to be in the same category because of the trends we're seeing. The other thing, though, I want to point out is that the metrics that are used on the risk dashboard are 3 of the 4 are based on trends. So as long as you keep the trends consistent with respect to the data that are going in, and there are no data abnormalities that are being put in place, the trends still hold, whether the absolute number is inflated by 10 or attenuated by a factor of 10. Okay, so that's all I had. I'll just say one quick thing. On the expanded reports, we do publish our GIS mapping, which will give our rates by zip code. You can take a look at that. Why that is important to you at home, if you'll notice in the 36572 zip code, if you look at absolute numbers, they're not going to be the highest, but if you look at 36572 in terms of a rate, they are the highest. That's also where we are seeing the highest number of issues in schools, and that's also where we're seeing the highest issues in some of the business establishments reported to us. So the driving factor of these GIS maps is the background prevalence in your area should inform you on what activities that you can undertake and the level of risk that would be tolerable based on your risk tolerance. So, okay. So, Mark, that's all I had. Any questions at all from? Okay, good deal. Thank you all very much. We'll be back on Monday with our expanded report.